Hi and welcome to my YouTube channel. My name is Dr. Tolu, and in this video I'm going to be talking about 5 reasons why that vaginal yeast infection keeps coming back. Now, if you like what I have to say, please hit the like button, hit the subscribe button, and leave a comment for me telling me how useful you found this video. And if you have something you would like me to discuss in the future, you can also leave it as a comment for me, and I'll do my best to discuss that matter in the nearest future. Alright guys, without much ado, let's begin. I'm first going to talk about what a vaginal yeast infection is. Vulvovaginal candidiasis is a problem that is usually caused by an overgrowth of a fungus known as candida. Now that might sound strange to you, that oh my god, so you mean I have fungi living inside of me? Yes, we do. We have it in different orifices, and one of the important places that it's found is the vagina, right? But the way the vagina is structured, you have good microorganisms and you have the not so good microorganisms. So we have the good ones, or what we call the lactobacilli, and then the not so good ones, but they are in balance, right? So it's almost like they've come to an understanding and the vagina is fine the way it is. And that's why we advise people not to wash the vagina. You can wash the vulva, the external parts of the female genitalia, right? You know, when you see the labia, the clitoris, that part you can see. But the vagina, we advise people not to wash it, because washing the vagina is one of the things that can upset that balance between the good guys, the lactobacilli, and the not so good guys, one of which is candida. Right now, when there is an upset of that balance, or anything that can lead to an overgrowth of the candida species, now that can lead to vulvovaginal candidiasis, or what we know as vaginal yeast infection. Now, it's important to understand that the things that can cause vaginal yeast infections are things that can either get rid of the good guys, like I explained, the lactobacilli, or anything that can introduce maybe more candida, right? And when we think about the common causes of recurrent vaginal yeast infections, they usually have to do with one of those two things. Either something you are doing that is removing the good guys, or something you are doing that is enabling the not so good guys, right? Now that I've explained the basics, let's get straight to the reasons in the order in which I just choose to discuss them. Number 1 is poor treatment of existing vaginal yeast infection. 3 out of 4 ladies in their lifetime will have a vaginal yeast infection, so it's that common. But then 1 out of 10 women will have recurrent vaginal yeast infection. That means they will treat it and it looks like it's coming back and coming back, and that may require a different form of treatment. But first, if a vaginal yeast infection is not properly treated, right, let's say you are given medication and you do not complete your medication or use your medication the way your healthcare provider advised you to, then what that can do is it may get rid of most of the candida infection, but then some of it may remain and over time grow again and cause another infection. So then what we advise is to follow your treatment. Don't stop. Let's say, for instance, those who have vaginal yeast infection, some of the common symptoms they have are maybe itching, redness of the vulva area, or they may even have a change in their vaginal discharge. It may start to appear thicker and lumpier, almost like cheese, right? That whitish yellow color of cheese. So many people, and this is quite common, when they've started their treatment and they don't have any of these symptoms again, they might stop the treatment before completing it. And when that happens, that infection, because it's not completely gone, it can come up again, and then that can lead to maybe even a stronger strain of the candida, which is what causes a vaginal yeast infection. And that brings me to the number 2 reason that I'm going to be discussing today as a cause of recurrent vaginal yeast infection, and that is drug-resistant strains of candida. So sometimes, maybe due to poor treatment or for some other reason, the specific organism causing that vaginal yeast infection in that person may be drug resistant, right? What that means is the drugs that we normally use, maybe the antifungal treatment that we use, may not work in that particular case, or may not work effectively, or it may just work partially, right? Now, for those who may who have been having recurrent vaginal yeast infection, it's very important for you to consider that what you might have is a drug-resistant version of vaginal yeast infection, and that can be treated, but then it usually requires a more aggressive treatment, and it may also be in combination with some lifestyle changes that you need to make. Number 3 has to do with lifestyle, maybe your lifestyle. And one important thing that I want to discuss here is the habits that a lot of women have of washing the vagina. Now, healthcare personnel will tell you that you do not need to wash your vagina. Your vagina is self-cleaning. Now, when we say this usually makes those with a vagina, especially women, to wonder, oh, what do you mean? You mean I should keep it? Won't it smell? Won't it be dirty? It won't smell and it won't be dirty. Here's why. Your vagina cleans itself. Now, what we say women should clean is your vulva. The difference between the vagina and vulva is simple. The vulva is the external female genitalia, right? That part that you can see. Like, let's say a woman takes a mirror and then puts it down to look around her pubic area. That part that you can see that includes the labia, the clitoris, all that is the vulva. The vagina is that tube that goes, that inner muscular tube that goes from the vaginal opening to the cervix. That is the vagina. The place where penis enters during penetrative vaginal sex is the vagina. So we advise women to wash the vulva with warm water, and you can decide to use soaps that don't have any scent, right? It's important not to use scented products, right, to wash the vulva, but the vagina does not need washing. The vagina cleans itself. Now, for those who engage in part of their lifestyle, they wash their vagina. That can upset the normal balance that I talked about earlier and can lead to an overgrowth of candida, which can then lead to yeast infections. And the thing about it is, like, it can then lead to a vicious cycle. Here's what I mean. So washing the vagina can get rid of some of the lactobacilli, lead to an overgrowth of candida. So get rid of good guys, lead to an overgrowth of the bad guys. And then when that happens, the woman then starts to see an abnormal discharge, like I described, thicker, lumpier, almost like cheese. And then to get rid of it, because it's irritating her, she washes some more. And then that can lead to more overgrowth, and then it's more, and then she washes again, and then she's wondering why this has been going on for so long. But then it all started with your lifestyle, what you are doing. Another thing about lifestyle is using scented products, right? That can upset the vaginal level of acidity, alkalinity. That's what we call vaginal pH, and that can also increase the risk of having vaginal infection. You don't really need to put anything in there to keep it clean. Your vagina is not dirty. And number 4 on my list is anything that reduces your level of immunity. Now, for some people who have illnesses like maybe diabetes or HIV, or maybe they have an immune disorder, can then lead to an overgrowth of candida and then lead to recurrent vaginal infections. Now, if you are treating the vaginal infection, but you have an underlying diabetes that is not being treated, your blood sugar is not being controlled, or maybe you have underlying immune disorder that is not being treated, treating the vaginal yeast infection might just be like pouring water into a basket, because unless you treat the thing that is causing a reduction in your immunity, whatever you are doing to treat the offshoot of that problem may not give you lasting results. So it's really important, if you've noticed that maybe you've tried all you can about the vaginal yeast infection and it just keeps happening, it's important to find out if you have anything that is affecting your immunity negatively. The last one I'll be discussing today, number 5, is quite simple. What you are treating might not be a yeast infection. Right now, here is that may sound surprising, but here's the thing. There are several different vaginal infections that may closely resemble each other. For instance, bacterial vaginosis can greatly resemble vaginal yeast infections. It can be misdiagnosed, especially if not properly handled by a health provider. In that case, you are using antifungals because you think it's a yeast infection instead of using antibiotics because it's actually bacterial vaginosis. So when you do that kind of thing, then you won't get results because you are using the wrong kind of treatment. So it's very important, if you notice any vaginal discharge or any symptoms that you are not happy with, to even be sure of what you are treating, to be properly diagnosed. And to do that, it's important for you to see your healthcare provider, maybe your doctor, to help with a proper diagnosis, because with the wrong diagnosis, then you most likely engage in the wrong treatment and you will get poor results. Alright guys, so I hope you found this video useful. Those are 5 common reasons why that vaginal yeast infection keeps coming back, and in discussing all of them, I also discussed how to handle those scenarios. So if you like what I have to say, please hit the like button, hit the subscribe button, leave a comment for me telling me how useful you found this video, and until I do another video and you see my lovely face, bye.